Hello, ladies and gentlemen. I want to thank you for taking the time out your busy schedule to find out about a revolutionary prescription program that's taking America by storm. We have the pleasure of having John Forensic with RX Care America take some time out of his busy schedule to give us a quick overview of just how powerful this program is. John has been a leader in the healthcare industry for over a decade. He likes helping people, and he's going to definitely give us a good presentation on how you can help some of your family, friends, and clients save on their medication. So without further ado, I'm going to turn this over to John. John, are you with us?
Yes, sir. Angelo, thank you very much. And I do want to welcome everyone that is attending the webinar today. As Angelo said, my name is John Forensic with RX Care America. And I want to thank everyone for taking the time to be with us. And I can assure you, the time we spent together today will be well worth your time. With that being said, we have some exciting news about a revolutionary new prescription program that we're launching that's going to be disrupting the prescription drug industry and will be the go-to prescription drug program in America. I hope after hearing about the program, you're going to be as excited about the opportunity and being part of this as we are. The name of this game-changing prescription drug program is RX Care America. Now, first off, I do want to clarify something. This is not one of those prescription discount programs or cards. This is an actual prescription drug program. This program is not insurance and it was not designed as an insurance product, but rather a pharmacy program. This is done by design, and that's part of the beauty of the program because by doing so, we did not have to deal with the insurance departments in each state. And I'm going to be explaining the importance of that a little bit later on. However, we are licensed in all 50 states plus Puerto Rico and the U.S. Virgin Islands. You have the ability to go anywhere in the country with RX Care America. Also, by not filing this as an insurance plan and not having to deal with the insurance-related costs that increase insurance premiums, we did not have to deal with claims reserves, which may take up to 80 to 85% of the insurance premiums, premium taxes, and all other miscellaneous insurance-related costs associated with high insurance premiums. And by removing those costs from the equation and not designing this as an insurance product, we're able to design this program so that everyone in America can afford it, and more importantly, should have it. And you're going to see what I mean a little bit later on. But before we get started, I want to take a minute and give you a little background about where we started and how we got here. This product was originally designed to meet the needs of the uninsured and the underinsured. I'm sure a lot of people on this call know individuals that cannot afford insurance or have watered down policies that really don't pay a whole lot when it comes to prescription coverage. Consequently, there are too many people in this country that need medications that just can't afford to take them because either they don't have insurance and the medications are too costly, or their coverage doesn't pay for them. As a result, people are going without their much needed prescriptions filled, or if they're able to come up with the money to pay for those meds, or splitting the pills in half so they can last longer. Well, folks, that defeats the purpose of taking medications in the first place. That's not how we should be taking care of our society, especially today, with prescription costs skyrocketing out of control and fully insured prescription plans being too expensive and cost prohibitive to the average consumer. And the people that should be taking care of us, the government, doing nothing to help. We realize there has to be a better way. And as we dug deeper into analyzing not only the uninsured and underinsured markets, we also realized the lack of prescription coverage in both the under and over 65 insurance markets. Short-term med plans, ACA plans with high deductibles, and people not getting subsidies or getting partial subsidies, Christian sharing plans, and indemnity plans all have glaring gaps when it comes to prescription coverage. Now, if you remember earlier, when I said the program was not filed as an insurance product by design, here's another benefit of that. In the over 65 market, although prescription coverage is available, for those that need their medications, there's also an issue with prescription costs when they hit that infamous donut hole in their coverage. Plus, this is also a cost-effective benefit for small businesses and the self-employed, as well as large groups that may be self-funded. It's a great way to help control their prescription costs, which in turn is going to reduce their claims experience and premium costs, as well as the amount they have to set aside for reserves. Also, this program is great for associations and unions Folks, there is no limit to who you can sell RxCare America to. Remember, everyone is looking for an answer for the high cost of prescriptions. You now have an affordable solution. Unlike all these other health and life companies that are competing with each other on a daily basis and beating each other up for the same clients, we've created our own vertical, our own niche, which there is zero competition. It's important you understand this. We are not competing with any insurance company's health products or their supplemental products. We are a complement and a supplement to these products. And if your client doesn't have any insurance, we're able to provide an affordable solution to their prescription costs. Let's talk a little bit more about RxCare America because it is the most revolutionary prescription program in today's market. RxCare America covers 90% of the most used drugs for only $5 for medication per month. And as I said before, it's available for both the under and over 65 markets. We are transparent and we have predictive pricing. The fact that we are not an insurance product means that if somebody has a pre-existing condition, it's guaranteed acceptance because there's no pre-ex or there's no waiting period to be accepted. And because of our electronic admission platform, RxCare America members can get immediate issue. There's no social security number required. For those of you that are dealing with clients that may not have social security numbers, RxCare America is a great fit. RxCare America is also approved for telesales. Plus, there's no claim forms that your client has to fill out. Getting a prescription filled with RxCare America is simple, easy, and convenient. RxCare America is launching in both the English and Spanish markets. And unlike some of these traditional programs that have on and off market and tell you when you can and can't sell, with RxCare America, you can sell year round. So how is RxCare America going to benefit you? Well, first and foremost, RxCare America is a freestanding program and can be sold by itself. However, if you are using additional products, RxCare America is a must-have add-on and game-changing supplemental benefit that you can bundle with your other products. RxCare America is also a great door opener for lead generation because everyone wants to talk about prescription coverage. And as I mentioned before, we didn't file RxCare America as an insurance product. And one of the advantages of that is you don't need to be licensed to sell this program. You know, we have a good friend of ours that has been in the insurance industry for many years, but he's property and casualty licensed, P&C licensed. He's not health and life licensed. So if this was an insurance product, he couldn't sell RxCare America. But the fact we didn't file this as an insurance product, rather a pharmacy program, he's able to offer it to all his clients in his property and casualty agency. So that's another advantage of RxCare America and the value add that it brings to the table. Folks, you should never walk away from a sale again with RxCare America. Let's talk a little bit more in detail about RxCare America and the prescription drug program and the benefits that are available. I call it the 5+1 program, folks, because we cover acute medications or what's known as immediate need medications, chronic medications, which are maintenance medications, over the counter, and the hot acronym now is OTC, as well as diabetes. We also have a pharmacy coaching and consulting program, plus we have a patient assistance program. So let's take a minute and talk a little bit more in detail about each component of the RxCare America program. Acute medications. This is what's known as immediate need. When I go to my doctor and he says, John, here's a prescription for amoxicillin, take it to your local pharmacy and get it filled. Well, that's the beauty of RxCare America, because with the acute medication program, I can take my e-card or printed RxCare America program, go to my local pharmacy, and we have over 64,000 participating pharmacies nationwide. So what we're not asking you to do, folks, is get rid of the relationship you have with your existing pharmacist. Because we have such a robust pharmacy network, we have both the big box chains as well as the mom and pop pharmacies participating with RxCare America. And the fact that we cover 90% of the most used drugs in America. And the other beautiful component is you never balance bill. It's a $5 payment and you're out the door. I think that's important is because of the fact that it's so easy and convenient to use RxCare America when it comes to acute medications. The second component of RxCare America is our chronic medications. This is what's known as maintenance medications. Maybe you need high blood pressure medications, maybe you need cholesterol medications, maybe you need birth control pills. We have over 24 therapeutic classes in our chronic medication formulary. We cover over 481 chronic medications, which is unheard of. You can use these medications for a 90-day supply for only $15 for 90 days. That's $5 a month. We're trying to be consistent and transparent with the prescriptions being $5 a month, whether it's acute or chronic medications. And as I said, we cover 90% of the most used drugs in America. And this is part of our home delivery program. And really, COVID has really changed how home delivery is viewed anymore. Before COVID, people would go out, but now people want everything delivered to them, whether it's through Amazon merchandise, food, and now we're finding more and more people want medications delivered to them. So our chronic medication program is a home delivery program, and we use the United States Postal Service. And one of the reasons we've partnered with them as opposed to an Amazon or a FedEx or a UPS is for two simple reasons. First of all, your package is delivered discreetly in your mailbox, so no one can see what you're getting. Down here in this part of the country where I live, 2 or 3 times a week, depending upon which news channel station you watch on the TV, they have issues with what's known as porch pirates, and they broadcast the fact that so-and-so got their medications or their package stolen from their front porch. Well, by using the United States Postal Service, it's discreetly placed in your mailbox, so no one's going to see a package on your front porch. So it gives you safety, confidentiality, and discreetness, but just as important is the fact that if someone steals something from your post office box or your mailbox, that's a federal crime. So we've tried to protect and put all the components in place to give you as much safety and comfort in knowing that your package is going to be delivered within a reasonable 3 to 5 day period. And the other nice thing, folks, is delivery is free. You don't have to go to the end of the cart and here for delivery, it's going to cost you X amount of dollars. All our home delivery programs through the chronic medications, we do not charge. They're free to the RxCare America member. The third part of RxCare America is our OTC or over-the-counter medications. Folks, we have the most used over-the-counter medications in the country at some of the lowest prices in the industry. We try to be at least 50% less than you can purchase these at the big box stores. And the nice thing is what we're seeing is folks that have maintenance medications are adding an over-the-counter medications on when they get the delivery, whether it's a vitamin or a supplement. We're seeing a lot of that coming out of our pharmacy. The other nice thing is we're seeing a lot of people that are completely healthy just order OTCs through RxCare America because, first of all, they're so inexpensive as compared to the big box stores. And one thing I do want to point out, folks, is the fact that whether you are ordering acute medications, whether you are ordering chronic medications, unlike fully insured prescription plans that may have a deductible that you have to meet before the plan pays, and some of these have monthly or annual caps that limit your coverage, which is going to limit how many prescriptions you can order that are actually covered. With RxCare America, there are no deductibles. There are no monthly or annual caps, and there's no limit on how many prescriptions you can order every month. Whether you order 1 or whether you order 100, it doesn't matter. RxCare America is here to help you save money on your prescription needs. And the other nice thing is if you just want to order the OTCs separately, you can do that. Now, we do require a 25% minimum shipment because if you're going to be ordering a $3 bottle of Tylenol, it just doesn't make sense. The fourth and probably the most part of RxCare America that I'm proud of is our diabetes program, folks. We cover type 2 and type 1 diabetes. And there's nobody in the market, and I'm going to go out on a limb, there's nobody in the market that covers diabetes like RxCare America does. If you have type 2 diabetes and you provide us with a prescription, first of all, we will send you a free bilingual glucometer 90 days worth of test strips, 90 days worth of Lancets free. We also have 16 oral medications. If you're taking any one of these 16 oral medications, and metformin is probably the most common that people are familiar with for type 2 diabetes, but if you're taking any of these 16 oral medications, they're free. They're no charge. Plus, we will ship them to you for free. That's an amazing value-added benefit to your client, folks. But let's take it a step further. Let's say you have a client that has type 1 diabetes. We provide Novolin, NR, and 70/30 cheaper than anyone else in the nation per vial. It's only $19.88. Plus, Novolin, NR, and 70/30, we also have the capabilities of offering the Flex Pen to your members. And again, the Flex Pen is cheaper than anyone in the nation at $37.88. And the beautiful thing about the diabetes program for type 1 diabetics, folks, is the fact that we have a partnership with Walmart. And the reason we have a partnership with Walmart is, for those of you that may know people that are diabetics or are diabetics, is it has to be a refrigerated product. And it would be too cost prohibitive to send it in the mail. So we have an agreement with Walmart where if you present your prescription, you can get the Rx Care America pricing of $19.88 or $37.88. And there are over 5,200 Walmarts nationwide. The fifth part of Rx Care America is our pharmacy coaching and consulting. This is a fantastic value add because you can deal with a pharmacist on a one-on-one. Folks, these are white coat licensed pharmacists. These are highly educated and well-trained pharmacists that focus on the highest quality of care for you and your members through Rx Care America. And the nice thing about this, folks, is there may be some folks that don't have a pharmacist. The Rx Care America pharmacist could become their pharmacist. Or if they have questions about a prescription, they can call and get advice and consulting and even coaching. Because if we feel there's a more cost-effective way, we will get on the phone with the member and their doctor and talk them through if it's going to be beneficial to the member. Now, folks, one thing I did say is the fact that we cover 90% of the most used drugs in America. But we also cover that additional 10%. But it's not going to be for $5. It's through our patient assistance program. Now, usually the 10% is for brand names and specialty drugs. You know, the drugs you see on TV at night, the Humiras, the Cimzias, the Zymbaltas of the world. These are patented drugs that we can't impact right now on a $5 basis. But what we can do is work with our patient assistance program. And this is a third party that we use. And we do a white glove handoff that can work with you. And sometimes it's need-based and get these specialty drugs at little or no cost. And this is a great value add so that if your client does have one of those 10% drugs, they can work with our patient assistance program and our member services department and see how we can help them save money on those medications. Now, there's no guarantees, but we've gotten great results for folks through the PAP and working through our member services department. Folks, one of the things I want to bring to your attention is the fact that Rx Care America was designed so that everybody in America can afford it. As I said before, this program was designed not as an insurance product. And since we've designed it that way, we've eliminated items that drive up premium costs, such as premium reserves, taxes, and other miscellaneous costs. And by making this so affordable, you should never walk away from a sale again. And you should never hear, you know, John, I can't afford that. So let's talk about how affordable this program is for your clients. As you can see, the single member rate is $9.95 versus a fully insured program that's going to be anywhere from $40, $50 all the way up to $120. Single plus one is $14.95. And the family is really where the glaring differential is. Fully insured prescription programs are going to run between $150 to $240 on a monthly basis. And that includes your deductible and your monthly caps. With Rx Care America, there's no caps, there's no deductibles. And the family membership is only $19.95. Folks, we've made this so affordable that everybody in America can afford it and should have this program. Now, one point I do want to clarify, and as I mentioned numerous times during this webinar, this is not an insurance product. And because of that, it has many advantages. And hopefully you've seen throughout this webinar. However, because it's not an insurance product, we cannot use insurance terminology. Such as we cannot call this a prescription plan, we have to call this a prescription program. Your clients are not insureds, your clients are members. They don't pay a premium, they pay a membership fee or membership dues. I bring this to your attention because we're disrupting the prescription drug industry, and we want to be fully transparent with our clients so that nothing gets misrepresented. I'm going to take a minute as we wind down here and talk a little about our website and back office. And from a sales and marketing standpoint, this is important that you understand this. When we designed the back office for RX Care America, we had the agent in mind because agents enroll people a couple different ways. And what we've done for you is allowed you to enroll folks through what's known as a replicated site. Now, what that is, folks, is when you get appointed with RX Care America, you're going to be able to pick the name you want for the RX Care America site. So basically, it's going to be the RX Care America site that's specifically designed with you and your contact information. So if you want to copy and paste a link and send it out to your client or prospective client, you have the ability to do that. We have a lot of folks that do internet marketing. And this is a great tool that they can use because, as I said, it has, if you can see my cursor, it has your contact information right here. It has the plans that are available right here. But if your client wants to go a step further, they can look at the top tab where it says Enroll Now. And what happens is they're going to be able to choose the plan they want, and they're going to be able to sign up for it. But the beauty of the program, folks, is by sending them your replicated site, they're going to do what's known as a self-enrollment, meaning they're going to do all the heavy lifting. They're going to fill out their name, their information, their credit card information, and they're going to submit the application on their behalf, and you're going to get credit for it from a commission standpoint. Couldn't be easier than that. However, we have a lot of folks that like to take an application physically while they have a client on the phone. And for those of you that are in the insurance industry, whether it's health, life, supplemental benefits, annuities, you're familiar with what I'm talking about. You may be going over the application with your client over the phone. You have their name, their address, their banking information. In this case, you would click our Agent Assist portal, click the Agent Assist, and again, you have all three programs that are available, and you can start taking the application physically for your client, meaning this is called the Agent Assist, meaning you're doing the enrollment. For those of you that are in the insurance industry, this is probably what you're most familiar with, where you're taking the application for your client, you're populating their information, you're populating their credit card information, and you're submitting this on behalf of your client. We have two different ways for you to enroll. Whichever way you feel more comfortable or with this in your business model, that's great. But we wanted to give you the options to make it as easy as you can to enroll members in RX Care America. I want to thank everybody for taking the time to attend the webinar. We hope after seeing this brief webinar, you are as excited about the opportunity as we are. Remember, you can be one of the first in the nation to have access to this game-changing, revolutionary prescription program. And remember this, if you don't offer this program to your clients, some other agent will. So let's beat your competition. If you have any additional questions, Angelo, how do you want them to handle that?
Well, thank you, John. I want to again say thank you for a fantastic presentation. Ladies and gentlemen, we're so super excited about this. I encourage you, look at this a couple of times. Matter of fact, get back to the person that shared this with you so that you can start taking advantage of this revolutionary program today. So until next time, ladies and gentlemen, we'll see you all at the top. Have a very, very successful week.